Good afternoon, Professor Ben. In your opinion, what should patients look out for when it comes to breast screening?
So I think it's, we have two scenarios. We have our non-COVID scenario and we have where we are now. So I think while we're all sitting in lockdown, what we need to realize is the anxiety of what if something's concerning and how do I tell. So screening, which I think we should talk about and maybe talk about in the next couple of days, is more relevant in a scenario where people can check and access healthcare services freely at all times. So here you're sitting, and one of the nicest classifications I like to use is the love classification because everyone remembers that word, and it's the concept by what must I look for. So we spoke last time about checking your breast once a month and how you examine your breast and what to do. Now we're going to say, what do you look for? So the common things, almost everybody has breast pain, boy or girl at some stage in your life. So we will separate out and talk about breast pain separately, but most breast pain is not cancer. Then we talk about breast masses. So when you're doing your breast examination, you're going to know your breast and see what's different and not different. And then there are different types of breast masses. Now we don't have eyes on our fingers, so breast masses are best assessed by an ultrasound. And we'll have a separate little talk around solid breast masses, breast cysts, and what I call solid and cystic breast masses and breast abscesses. So there are breast masses and then there are breast abscesses. So when you have red hot inflammation and an area of pain and discoloration, and it's either an abscess or cellulitis, which really means inflammation in the tissue. Again, a topic on its own, common in breastfeeding moms, also common at other phases in people's lives. So then we have breast nodularity, and I think that's what we all feel. You examine your breast and you think, that feels all lumpy, bumpy. Is this my normal breast or not? And the secret around that is if it's the same every time you examine your breast once a month, then it's probably just your breast tissue, lumpy, bumpy breast tissue. If it feels different to what it did, then obviously we need to access healthcare at the moment. So really what we're doing with this tutorial is we're saying, here you are, you're not screening, you're sitting in a situation where when do you know you should access healthcare? So not so common for breast pain, keep an eye on it. Commonly, if you see a breast mass, absolutely see if you see redness and an inflammation, query, and infection. Nipple discharges, really we divide them into, do you see it on its own? Absolutely seek health care. Or does it leak when you squeeze your nipple? Your breast, okay, it's full blonde, the nipple is a glorified plug, do not squeeze it. So we've mentioned pain, nodularity, breast masses, inflammation, and infection. So I think that's all for today because we don't want to overload ourselves with knowledge and information. And from here, we can go forward, talk about screening, and talk about each little aspect individually so we know when we should be alarmed, when we should seek health care, or when we should say, let's just give it a couple of weeks and see how it settles.